the beginnings of them around their 50s or 60s, and then we can see it increase from there. Some develop very quickly, some take longer. I've seen people in their 90s that still would not require cataract surgery.
So there are some people that may never need it, but generally speaking, most people should at least be examined for it.
Oh, absolutely. For cataracts as well as a whole host,
Sure.
diabetes, high blood pressure, cholesterol, anemia.
But it's possible not to have to ever have a cataract operation.
Well, if we live long enough, we'll all develop cataracts.
Meaning you can't be 100 years old and not have a cataract operation?
Well, we'd have cataract. It's at what stage, and is it medically necessary to remove that cataract?
Sure.
However, as we're all living longer throughout life, we're seeing more and more need for cataract surgery,
Right.
and it is the most commonly performed outpatient procedure in the United States today.
And there's no pain connected with it, they tell me?
Very, very little. Nowadays, cataract surgery typically takes about 15 minutes of actual surgical time. The healing recovery rate, we're up and about the next day. The eye is a little bit sore, but we give medications for that along with to prevent any type of inflammation, any infection,
Right.
and most people do very well.
Well, that operation that people used to have to correct their vision without put them in the position so they don't need glasses anymore. PK, what?
Well, there's RK, PRK, LASIK, likewise the CRT, the corneal refractive
Okay.
therapy. They're also doing another study right now up at the university working with placing a lens on the eye to reshape it, putting a drop of riboflavin, which is a vitamin,
Yeah.
in the eye, having ultraviolet laser shine on that, and that actually reshaping the cornea as well.
Really?
And we're utilizing that for people with keratoconus, which is a corneal dystrophy.
Okay.
But that might be the new LASIK in 5 or 10
Sure.
years from
But
now.
people don't do the old thing where they cut the...
The incisions, no,
Yeah, no.
we're beyond that now.
So now what are you doing for people that don't want to wear glasses anymore but want to have corrective surgery?
Well, typically I tell them there's two best options. LASIK, utilizing wavefront technology in the skills of in the hands of a skilled surgeon, people often see 20/20 or better. There is also what's called a clear lensectomy, which is essentially the same thing as cataract surgery. However, instead of putting in a distance-only single vision implant, we're able to put in a bifocal contact lens as an implant inside of the eye. So it allows us to see both far away and up close.
Sure.
Likewise, we don't have to worry about cataracts developing later in life since we've already taken care of that.
Sure. Well, what about the other thing that I hear so much about, macular degeneration?
Correct.
Talk about that just a little bit.
Well, it's not as prominent up here in the northern states. Down in the south, because of the increased intensity of the light from the sun, we see a lot higher
So it's related
incidence.
to the sun.
Oh, absolutely. There's a number of factors that go into it. Sun exposure, smokers, drinkers.
Really? That makes a difference?
Oh, absolutely. It builds up free radical damage in the macula, that very sensitive tissue that's our central vision, and causes it to deteriorate over time. Likewise, genetics comes into play. A lighter-eyed person is more apt to have a macular degeneration changes towards later in life.
Sure. What about testing for young kids to find out if they have a requirement for glasses or correction of some kind? Are you involved with the school systems where you're doing that?
I'm involved in a number of different programs. Starting off, I'm involved in infancy, which provides a free eye exam to infants between the ages of 6 to 12 months.
Oh, okay.
Just to determine.
And who are you working with to get that going? With the clinic or the hospital? or-
That's an affiliation with the American Optometric Association.
Okay. So what are you doing? Advertising? Because how do people know about this?
If they go on to the American Optometric Association website, likewise, a lot of the pediatricians are aware of the program as well.
And what is that website address for anybody that's interested?
www.aoa.org.
Okay. And if somebody was interested in asking you a question, that you have a website and they could go ahead and ask you a question on the website?
We're currently still developing our website right now. It should be up in the next month or two.
Okay.
However, right now we have a Facebook page, as well as they can feel free to call our office at any
Plus,
time.
you got one of those electric telephones that people could call up.
Absolutely.
And say, sure. So, how do you compare Beloit with like Madison? Are you getting the same kind of eye problems, or they have more problems there because they trip and fall over the teachers that are picketing and that kind of stuff?
Well, primarily
Madison.
in Madison, I was doing a lot more routine vision exams, younger, healthy individuals. Down here in Beloit, because of inheriting the patients from Dr. Johns before he retired, I have an older patient demographic. So I do see a lot more pathology down here in Beloit. However, we do service, as I said, from 6 months on up.
Sure. Well, what are you doing as far as your current patients that you acquired from Dr. Johns to let them know you're in there? Are you bringing them in for examinations? Are you asking them to come in and meet and greet? Have you done some kind of a social function where people can get to know you and that type of thing?
Yeah, we had a grand opening. I purchased the office in March of this year. We did have a grand opening that we advertised with the State Line News as well as the Beloit Daily News. We were giving out popcorn, lemonade. We had a trunk show with a number of various frame vendors under a few tents that Roger Bryden allowed us to put up on the parking lot directly adjacent to ours, as well as an open house. Since then, we've been operating very well on word of mouth. The individual patient referrals from patients that we see going out into the community and recommending us.
Are you advertising any place regularly, like in the shopper or on TV or radio or anything like that, or just mostly word of mouth?
Currently, mostly word of mouth, and we've been doing just fine with that. I did a little bit of advertising, and I frankly wasn't getting a very large bang for my dollar.
Sure.
So with the word of mouth, and likewise, I'm able to put more money into the actual business. So where I've acquired a number of new technologies. We have a digital retinal camera, an Optimap, that's able to take a high-resolution scan of the back 180 degrees of individuals' eyes.
Wow.
Likewise, we have a high-resolution monitor, so instead of having a lighted projector on the wall, we have high-resolution letters that I can constantly randomize, as well as a number of other things that we have in the works.
Sure. Well, what kind of I kind of asked you this before, but I want to be a little more specific about it. What kind of a relationship do you have, like with the Beloit Hospital and the Beloit Clinic and the doctors that treat eyes up there? You mentioned that it's important to know what the situation is so you know who to refer them to, but I'm wondering if you have a working relationship where they might call you and say, could you fit them for glasses, or how's that work?
Absolutely. I mean, as eye doctors providing care in the same area, we have a lot of mutual patients, both with the ophthalmologist at the Beloit Clinic, as well as the primary care physicians.
You got Dr. Rojas up there?
Correct.
I don't know any other ones, but...
That's okay.
Yeah.
So, when I have a patient in my chair that might be, Dr. Kodris, who's a primary care physician at the Beloit Clinic. Okay.
Yeah. Sure.
And I see diabetic changes in the eye. I'm going to write him a letter and inform him of what we're seeing. And likewise, he can communicate things back to me if he wants me to pay particular attention to something.
Sure. So, do you see any new cutting-edge things coming down the pike like we've had in the last 10 years? It seems like we've had all kinds of innovations in finding out ways to use different methods that they never had before, where they don't have to go out and keep wearing the glasses if they don't want to.
Correct.
With various LASIK things. And of course, I don't know what I'm saying, but
Absolutely. Well, the field is changing so rapidly. It's difficult to keep up with all of the changes.
you go to continuing education things all over the country all the time. And
Absolutely. And I make sure
Keep
I
up on
usually
stuff.
go to about twice as many as what I'm required to,
Sure.
just because of the level of service that I want to provide for the patients. The knowledge base that needs to be there.
Sure. Have you contacted anybody in the school system to offer some kind of eye testing?
Well, the Lions Club, which I am a member of,
Oh, sure.
does offer vision screenings for the elementary, middle, and high school students.
You work with that Dave Peltier once in a
I
while?
do.
You
I do. Very good guy.
Yeah. They're a good club. They do a lot of good things around Beloit.
Yeah, we do.
So, were you in Lions before you came to Beloit?
No, I was looking to be involved in one of my patients. Actually, the first week that I purchased the office, mentioned that, oh, you're the new eye doctor in town. You should become affiliated with the Lions, with their mission focused on eye care. I said absolutely. So I went to a meeting, and I think I joined within the first month. Then.
Sure. Well, they have a eye program where they do something with ice and buckets and eyes. How does that work?
Eye transports.
Yeah.
Primarily what we're doing is harvesting corneas. The cornea is the clear part of the eye that if we were to put a contact lens on, what the contact lens would sit on. Yeah. For certain individuals, such as the keratoconus that I mentioned earlier, Fuchs endothelial dystrophy, or a number of the other corneal problems, their cornea is so cloudy, so opacified, they cannot see clearly even with the best prescribed glasses or contact lenses. Sure. So we take the donor tissue then, usually up to a hospital in Madison, and we're able to transplant that onto the needing individual.
And what do they do with the glasses they collect?
With the glasses that we collect, primarily those are going to go out of country to third world countries, and we're able to provide the vision care services to the needing individuals.
Sure. Is there a way that you can let people know, other than when you haven't got your website yet, but the type of services that optometrists, particularly yourself, offer to people that are curious about what can be done for this ailment, or what can we do to prevent this? Getting the word out. Mm-hmm. Do you have a method of doing that?
Well, I spend a lot of time with the patients in the exam room. You mentioned the competition with the larger corporate optometry offices. Typically, they're spending about 15 minutes with the patient. My exams typically last 45 minutes to an hour. Mm-hmm. So we do a lot of education during that time, informing them both of the conditions that I'm finding as well as the recommended treatment, and if follow-up is needed.
What about the 3D movies in that? Does that have any injury to your eye, or can that hurt anybody?
Not at all. It doesn't hurt anybody, but it does bring problems to the surface that the person might not necessarily be aware of. People, if both eyes are not necessarily seeing clearly, one eye has a strong prescription that's not being corrected for, they're not going to be able to visualize those 3D movies.
Sure.
Likewise, if there's muscle
imbalance. So they're kind of good for you. They're helping diagnose in a way.
Absolutely, and it helps us to catch them at an earlier age. The earlier we're able to detect these problems, the better likely result that we're going to have by treating it then.
Right. Now, are you, in this world of technology and everything that's going on, are you able to take like an eye, what did you say, cornea, or what are you transplanting?
Cornea is what we're transplanting currently.
Can you do that from Madison, Wisconsin to someplace in Africa? Or is that
it is very difficult. It is possible. We do perform those types of procedures, but being able to have the relevant corneal tissue as a donor lined up with the surgeon, there's a very small window. So it does happen, but it's to a lot lesser extent.
Well, in the remaining minute or 30 seconds we have left, what would you encourage people out there to call you about?
Well, I provide routine and comprehensive.
Why don't you give me your telephone number?
Our telephone number is area code 608-365-8575. And we provide routine vision as well as comprehensive medical eye exams, testing for glaucoma, cataracts, diabetes, problems with high blood pressure, as well as a red, irritated, pink eye, contact lens related problems, as well as a whole host of other.
Dr. Doug Kelley, thank you very much for being a Builder of Beloit, and thanks for being on the Builder of Beloit show.
Well, thank you very much, Bob.
You too. Dr. Doug Kelley. And that, as we say, is that.